Whoa, what's up, guys? Dr. Dan in his house. What's up? Canna fam. Check it out. Coming in from Little Rock. It's been a long time, far too long. Far too long. Look, guys, I just wanted to jump into it in between patients. I don't know how long I have here. I know I've been extremely deficient on doing my live casts. No excuses. I mean, I did have a baby. Well, I didn't. My wife did. I only helped with the front part and cheered on at the very end. Very frightening watching a childbirth, I will tell you. Ladies, thumbs up. My wife, thumbs up, honey. Pushed out that football, man. That was great. Quite painful to watch and quite painful, quite frankly, to push that thing out. So anyway, on to other news. We're happy to say that we're well established here in the Little Rock area, West Little Rock area. We are going to be changing offices here shortly, but we are here up and running, nice here in the corner office here in West Little Rock on Shackelford. But I did want to dig into a whole lot of mental health and some stuff regarding medical marijuana and where it works in, because it's just really a huge topic. Broadly speaking, I speak on PTSD broadly a whole lot. I've spoken on this a whole lot and probably will continue to speak on it a whole lot. But for this particular portion, I do want to touch on depression in and of itself. Not necessarily, broadly speaking, PTSD, but depression itself and marijuana, really, because it's one of the caution points when it comes to certifying a patient. Here in Arkansas, at least, depression is not a qualifying diagnosis to get certified for a medical cannabis card. Really, the only mental health diagnosis on the Arkansas list is post-traumatic stress disorder. Anxiety and insomnia are also not on the list here in Arkansas. Nonetheless, if a patient qualifies, for a certifying diagnosis, they can certainly use their legal cannabis to treat other symptoms, okay, as they arise. Once they have the card at that point. And the treatment of depression comes up a whole lot because oftentimes people hit sort of a wall if they've been taking SSRIs, these serotonin reuptake inhibitors, or the norepinephrine uptake inhibitors. You'll see this effect sort of in the vaccine. Also keeps more adrenaline in the nerve terminal, sort of to address the anhedonia aspect of depression, which is the inability to feel happiness. Hedonism, happiness, that sort of deal. So anhedonia, without happiness, that aspect of depression that makes it very difficult to get off the couch. That's where the adrenaline rush comes in, give you that little motivation. And it's been noted, apparently marijuana, they say, lifts the mood. Who'd have thought? Makes people happy, sort of makes them beat the little drum and strum an acoustic guitar, tell good jokes, enjoy each other, be sociable. So it's been written, it's been said that marijuana can lift the mood and really put a bite in depression. And the subject matter has come up a whole lot lately on the backdrop of the coronavirus pandemic and people being increasingly more shut in. And now with people starting to get out a little bit more and socialize a little bit more, we're seeing the end of it where people are coming out saying marijuana was very, very useful and effective in addressing a lot of the shut-in symptoms. Depression can worsen when you're cut off from a lot of your social contacts. And it was evident when people were faced with that, they were able to cope with it a lot better if they had access to their medicinal cannabis. And this is word from patients. It's not my conjecture. I don't really speak from conjecture. So then I'd have to come up with my own ideas. And that takes a lot of energy, folks. To be honest with you, I think a lot of the best info that I've gotten in my years of clinical practice has been what my patients have told me works and does not work for them, rather than me telling them what I say should and absolutely should work because the textbook says so. Textbook is really a good guideline and a good starting point, but ultimately the results come from the patients. So there's that. So I just did want to touch on that because there is caution sometimes in the dosing of marijuana, because when overused can worsen depression, can make it worse if the coping skills are not in place and people are left to over marinate deep into their thoughts into a dark place. Maybe they get a THC strain that's too high, strain with THC percentage too high, and they take themselves 3-4 puffs too many, and they're shut in alone, and somehow their thoughts get away from them, and they don't have an outlet to bounce these ideas from, and someone just tell them, hey, maybe you just drifted down the rabbit hole a little bit too much. Let your thoughts go dark and didn't allow yourself a little bit of patience and space to let yourself come around. So there is caution. I do like to throw some caution at people in terms of dosing, depending on where you're at in terms of your mental health. If you're not one of these people who reaches out a whole lot and is in contact with your family and friends, or has otherwise a sounding board, then I just sort of throw a little bit more caution to you in terms of being mindful about your dosing. But apart from that, guys, I did want to wrap up, make it real quick. I think I have patients have to motor and go see. As far as the depressive aspect and marijuana's utility for it in addressing the depressive type symptoms, the constellation of symptoms that come with the depression diagnosis. It's a group of diagnoses. There's ranges of severity based on how often it occurs, the severity of impairment of daily function. So it's a group of diagnoses. Nonetheless, marijuana seems to at least hold some sort of promise when used as an adjunct or as monotherapy in addressing depression. Of course, you have to keep a close eye on things, and if we're not getting as far as we need to get with medical marijuana, then certainly we need to look at other things. Ultimately, we need to keep patients safe and address their symptoms. And if we can't get as far as we need to get with cannabis, then we need to go in another direction, and we have to be mindful about that and realistic about the limitations. And I talk about those things a whole lot. There are limitations with medical cannabis. With most therapies, there's going to be limitations to their efficacy and the endpoints, what we're expecting to achieve when we're using it. So, it's very much worth a discussion, and each patient should be tailored on an individual basis. And when physicians come into contact with patients who are using medical cannabis, these patients are also allowed their fair due in taking, an appropriate history and an appropriate medication reconciliation and social history and appropriate physical examination when necessary, to dot the I's and cross the T's. Family history is also important. If the patient has a family history of ill mental health, that's something that needs to be taken into consideration. Recent hospitalizations, their overall health status needs to be taken into consideration, because there might be a physical underpinning that might be behind the depression that medical cannabis can't address. And there might be another issue underlying that needs to be addressed that might be a medical reason for their depression. That's the reason why we need to be complete, be it the medical cannabis doctor or the primary care physician, and their evaluation of the patient, and be mindful to not stigmatize patients if they so choose to use alternative therapies. Keep an open mind on both sides. Listen, folks, too long since the talk, all my fault. I take full responsibility. If I could find someone to blame it on, believe me, I would. But no one to victimize yet. So good talk, guys. Let me know if there's anything you want to jump into. I love talking about mental health. I love digging into the whole topic of alternative therapies, not just medical cannabis, but marijuana has a whole lot of promise just to be used sort of as that sixth man, that extra thing, just to address symptoms. And I never pull punches with patients about cure for their ailments that they might be addressing with marijuana. Really, it's just looking to address, more than anything, symptoms. I don't think I'm going to solve anyone's sciatica with medical marijuana. I don't think I'm going to solve it, but it's really good as an adjunct if they're using it with a good stretching routine, if they just need something to back up that gabapentin or Lyrica, something to keep them from taking too much NSAIDs or cut down on their tramadol dose, keep them away from opiates. It's just really another adjunct just to add on. So I don't claim it to be this all-encompassing panacea to really solve all ills, but really as a really good adjunct to back up, to give people that extra bit of edge, that extra bit of confidence in the day. Who couldn't use confidence? All right, marijuana motivation. Dr. Dan, love you guys. Over and out.